Metro Manila and 4 nearby provinces now under GCQ for the next 2 weeks. But the so-called GCQ bubble comes with additional restrictions.
Hindi po yan hard lockdown kasi bukas ang ekonomiya. But it is a restriction of movement.
And today's 8,019 cases has brought the total tally of cases to above 671,000.
Numero kasi na 7,000. Alarming yan, of course, but that's not the complete picture. Kasi karamihan sa mga nagpo-positibo are asymptomatic. But at the end of the day, pag naswamp ang ating mga hospitals, our healthcare system, then we will have to go into a hard lockdown or yung tinatawag na ECQ. Sana hindi tayo umabot doon, Jay, kasi sad-sad na yung ating ekonomiya.
2 more COVID-19 variants are now undeniably clearly in Metro Manila. More private hospitals are also reaching full capacity in NCR, and 4 other areas are in a bubble. How will the situation change over the next 2 weeks? We discuss in this episode of the Chiefs. Welcome to this special edition of the Chiefs. With me via Zoom are Ed Lingao of One News, Lucy Cruz Valdez, Chief of One News, Ed's boss, Ami Pamintuan of the Philippine Star. Chiefs, welcome.
Good evening.
Good evening.
Good evening. Ami, ano bang balita? Anong binabantayan natin? As if we don't know.
Well, nagsasalita ngayon si Presidente, pero siyempre, yung mga humihingi ng tulong ngayon, ng ayuda ng mga workers. Sabi naman na Malacanang hindi magbibigay kasi everybody's working still. Temporary lang daw yung ating travel bubble. GCQ bubble.
Nako, I hope so. Whether it's temporary remains to be seen.
Sabi kasi, di ba, kailangan at least baka ma-extend yung 2 weeks but baka naman mag-epekto itong 2 weeks natin.
Yeah, well, this is, in a way, this is what Okta Research was recommending coming to pass. Basically, one way to just frame it for you is to think of it as a 2-week Holy Week, a 2-week slowing down, if that helps at all in coping with the hard times ahead.
Pero sabi rin po ng Okta nung Friday night, things are gonna get worse in the next 2 weeks before they even get any better, because we're looking, of course, at a lag time. Because of, for example, the incubation periods. So whatever we do beginning today with the bubble is not gonna have any impact until 2 weeks later. So we will see the numbers go up.
Yeah, and
Tingnan natin kung paanong enforcement, kaya dapat tanungin na natin ang ating guest.
Speaking of beginning today and makita natin yung implementation, our guest tonight will hopefully help clarify for everybody what we can expect. We have PNP OIC Lieutenant General Guillermo Eleazer. General Eleazer, welcome po to the Chiefs.
Good evening,
Welcome,
General.
General.
Welcome back.
Lucy, Ami, Ed, and Robbie. Nice to see you again.
Siguro
Nice to
po,
see you too.
umpisahan natin because throughout this past day, people have been trading new terms, new acronyms, new definitions of geographic areas. Maybe umpisahan po natin sa paglalatag nyo. What is the easiest way for people to understand kung anong mangyayari?
Yes, thank you, Robbie. Meron akong prepared dito na few slides. Well, we know that NCR, consisting of 7 cities and 1 municipality, is considered to be an area or territory. So just like any other province or highly urbanized city, so yung movement ng travel dyan is hindi siya restricted. But with this implementation nitong bagong guidelines based on Resolution 104, in-expand natin ngayon itong NCR. At ito na nga, yung bagong term na sinarinig natin, NCR Plus. We included the other provinces na adjacent to Metro Manila, which are Bulacan, Rizal, Cavite, and Laguna. And then, sinabi natin na nilagay natin siya sa isang bubble. The purpose of which is to isolate this particular subject area, yun ang sinabi nila, which is NCR Plus, to the rest of Luzon or the country. So the guidance of the PNP, based on our mandate, is to see to it that itong mga kababayan natin na nasa loob ng
Bubble.
area, itong bubble, hindi pwedeng lumabas. In the same manner, yung mga nasa labas naman, hindi pwedeng pumasok. Except, syempre, meron tayong exemption, itong mga upper na pwedeng mag-cross. So, ang ginawa natin is that we identified itong mga thoroughfares, na mga ingress and egress dito sa iba't ibang mga boundaries nito, and then naglagay tayo ng mga quarantine control points. Meron diyang ibang area na wala talagang mga kalsada, like itong boundary ng Rizal and Quezon. So, but our chiefs of police were instructed na dapat mabantayan din natin sila. So, ito ngayon, dati kung meron tayong travel authority dun sa paglipat-lipat natin or movement, sa ngayon wala na talaga siya. So, sa ngayon, it's either upper na lang or non-upper. And itong mga list na ito yung narinig natin for the past kahapon at saka pati sa ngayon, na ito lang yung pwede mag-cross dun sa border.
Linawin lang po natin, ano po yung upper?
Yes, authorized person outside residence.
Okay.
Meaning, ito lang yung authorized na pwede mag-cross ng border.
Okay.
Pero pag nasa loob ka ng bubble, alam naman natin na available pa rin yung mga goods and services na pwedeng essential and non-essential na pwedeng avail ng ating mga kababayan doon. But, confined na lang tayo sa loob. So, ibabalik ulit na the concept of the implementation of this guideline is for our personnel, lalo yung mga nasa quarantine control points na doon sa boundary, bantayan natin sila na hindi sila lalabas o hindi papasok. Pero sa loob naman, ang role ng ating mga police is to see to it na kung sila inasa labas, andun sila, ino-observe nila yung mga protocols set by the guidelines. Nagkaroon ng stricter measures. Di ba? Nakita naman natin yung reduced operational capacity and naglatag din ang DOTR as well as maraming tinanggal na iba pang mga leisure activities. But still, the people inside the bubble can move within the bubble.
Within the bubble, okay.
Supposed to be unrestricted.
Okay. Una-una po, lilinawin po natin sa lahat ng mga suki namin na guest dito sa The Chief. Simula ngayon po, required magdala ng sariling computer graphics. I mean, this is by
ng graphics nyo, sir.
This is but seriously, General, this is by way of really thanking you. Napakalinaw po ng illustration. This is the kind of thing that people are really looking for. So, linawin ko lang po in case I got that right so that it's clear. Ang tinatrato nating bubble ay yung tinatawag na NCR Plus. So, hanggang Bulacan, hanggang Laguna, Cavite, yan po tinatawag na NCR Plus.
Yes, tama yun.
And then pagka sinabi po natin, we can move within the bubble, hindi lang within Metro Manila. Doon po sa pinakita niyong bubble.
Yes, tama yun, Robbie.
Okay.
Okay, so para lang po klaro, yung mga gustong pumasok, anong mga ipapakita para patunayan na meron silang business or dahilan para makapasok sa NCR at sa bubble na yan, yung plus.
Yes. Tama, Luchi. Di ba sinabi natin kanina na basically yung mga essential workers, meaning kung ikaw ay nagtatrabaho doon sa mga permitted industries, whether doon sa labas ng bubble o sa loob, pwede kang mag-cross doon. Mula naman nung una, even last year, ang basic requirement lang is ID. And samahan na rin ng certificate of employment para malaman na talagang nagwo-work ka, kaya ka mag-cross ng mga boundary. So, basic
Pero
ID
syempre, sir, kunyari, marami sila sa isang van. I-inspectionin nyo pa ba kung naka-mask, kung alam niyo yun, gusto lang namin malaman gaano katagal yan at nakaka-traffic siguro yan, I'm sure.
Tama yun. Alam mo, Luchi, talagang yun ang consequence na makikita natin doon. Kaya nga, ang ating mga pakiusap nga, sana wala nang humalo doon na mga unauthorized or non-upper. Kanina, nagkaroon kami ng inspection. Kasama ko si Lieutenant General Cesar Binag, the Commander of Joint Task Force COVID Shield. pumunta kami sa area ng Bulacan at nakita natin doon sa boundary ng, alam mo yung Bulacan kasi, dalawa kasi yung boundary ng province nila sa Nueva Ecija and then sa Pampanga. Yes, so na-check natin doon na doon talaga yung dulo na kailangang hindi papasok o walang lalabas. But nakita natin na marami pa rin siyempre mga workers pupunta and because of reasons of humanitarian and medical reasons, meron pa rin sila pumapasok. So, sina-check natin yon. Well, doon naman sa loob, kasi kanina na nakita natin kasi merong konting na, well, hindi natin masabing confusion pero naghigpit din kasi yung iba na yung dati nating boundary nitong NCR and Rizal na lagi natin binabantayan. Pero since sa implementation natin ngayon at nilinaw natin na nasa isang bubble na rin lang tayo, so supposed to be wala ng boundary yan. Ang NCR and Rizal, like in San Mateo and Quezon City, wala na yun. So we advise the concerned unit commanders in the ground na wag nang sitahin yun kasi we are no longer restricting the movement. But ang dapat i-check natin doon, at yun ang sinasabi natin sa mga pulis natin sa NCR, see to it na yung mga nakikita nating mga kababayan natin, hindi nagkukumpul-kumpulan at ino-observe yung mga health protocols at ino-observe, sinusunod yung mga strict measures na ini-implement natin na na-explain na rin doon sa ating mga balita.
General, yung kumpul-kumpulan, we're going into the Holy Week, no? At saka sinara naman yung ibang mga simbahan, sila mismo nag-lockdown na. Pero, siyempre, magkakaroon ng bisita iglesia yan, Holy Week eh. Paano pag nagpuntahan yung mga tao sa labas ng
Payagan
simbahan
ba yun?
at iikot doon sa, marami yung mga, may mga compound dyan, lalo sa mga outside Metro Manila, may mga stations of the cross yan. Papayagan ba sila or sakop ba sila ng 10-person maximum gathering in one place? Paano yung guidelines doon?
Yes, dito po sa within the 2 weeks na ito, di ba sinabi nga na walang mass and religious gathering. So wala po yung mga celebration o mass or other religious activities. Pero siyempre yung ating mga kabayan baka nga pupuntahan o iikot sila doon. So as long as, para po sa amin po, meron pa rin tayong mga personnel that will be deployed in the vicinity of our religious establishments, ating mga simbahan. Para kung sakali mo may pupunta doon, as long as naman po na ino-observe nila yung physical distancing and they wear the necessary shield and mask, wala po naman siguro magiging problema yon.
Okay, General,
I'd like to ask about this kasi well, obviously the bubble will help to prevent or at least hinder yung spread ng virus outside of what you would call Metro Manila Plus, itong Metro Manila, Laguna, Rizal and Cavite. However, by itself, the bubble will not address the infection already raging inside Metro Manila Plus, which is basically the epicenter. Kumbaga, ito talaga yung pinaka kaldero na kung saan kumukulo yung sakit eh. I'm wondering lang whether this bubble is sufficient to address the raging infection in Metro Manila, considering na it just contains us in the same area, basta lang hindi lumalabas. Pero yun nga most of the infection na is here. I'm wondering lang whether this is sufficient in addressing this problem.
Yes, Ed. Actually, ang ating pulis naman is involved lang sa enforcement. Pero in my understanding, tama yung sinabi mo na kasi ang apprehension po kasi nung ibang nasa labas ng Metro Manila or yung Mega Metro Manila is nagagaling sa atin yung mga may sakit. Kaya nga maganda, huwag natin palasin dito. Pero habang kinocontain natin sila, aside from the enforcement na ginagawa namin na para masiguro na nag-observe sila ng health protocols, syempre andyan naman po yung mga intervention na ng ating health sector kung paano ma-address po through the testing and then isolation and all this treatment, yun naman po yung tinututukan nila. Pero sa ganang amin po, ang naintindihan lang namin is ipatupad yung mga guideline and we will do our best para naman po doon sa share natin na makatulong na itong Metro Manila or for that matter, the Greater Metro Manila or NCR Plus, sana po mapababa na ito na experience natin na pagtaas. Ako, idagdag ko na lang here in the PNP, itong Camp Crame for the past days, talagang grabe din ang pagtaas po sa amin. Talagang, we are part of the jail population and if there is an outbreak here in Metro Manila as the epicenter, siguradong damay din kami doon, lalo na at kami frontliner. And tumutulong kami na while we are containing ourselves also, at kami rin po ngayon, almost lockdown. Talagang reduce in capacity, but just the same, tuloy pa rin yung trabaho natin para makatulong tayo. Doon sa sinasabi mo, Ed, na ang effort naman ng ITF is for this to be remedied or ma-address ngayon on the health aspect of this.
Okay, General, malinaw na po yung borders natin. Malinaw yung gagawin nyo sa borders. Now, let's talk about, as you said, allowed naman ang movement within the bubble. So people can still go to work. They can still go about their business. But as they move around, lalo na yung mga nagbubus, mga nag-jeepney, mga nag-LRT, nag-MRT, o kahit naglalakad, nagbibisikleta, ano po yung mga patakaran at saka ano po yung mga bagong pamamalakad that people should be braced for and should understand?
Well, ang DOTR po, naglabas na sila ng mga guidelines, specific guidelines na para sundin doon sa mga public transportation. So, yung mga basic naman po niyan, di ba? Yung chine-check yung temperature, and then sinisiguro na talagang one seat apart sila o reduced capacity. Andito po, nilabas po yung mga guidelines, and our personnel, particularly those who are involved in checking the vehicle, is alam nila yung ang kanilang gagawin. And para sa ating po mga kababayan, while it is true that public transportation is still there, pero yun nga po, reduced capacity siya. Now, on other matters like, ito po yung sa public transport, pero kung babanggitin nyo rin po yung iba nga na mga establishments like malls are still open pero in reduced capacity. Kagaya po ng nasa government agencies na kami is 30 to 50%, ini-encourage din yung public sector. Well, bukas pa rin po yung mga restaurant natin, pero sinasabi nga na even though maximum 50% siya, pero dapat walang indoor dining at kung outdoor man siya, meron pa rin additional measures or...
Pero ang tanong ko nga dyan, General, paano nyo i-check yun? Papasok kayo sa mall? Paano nyo i-check na ng isang establishmento talagang sumusunod dun sa whether it's 30% or 50% or whatever? Paano yan? Magbibilang ba kayo? Papayagan ba kayo pumasok para mag-inspeksyon? Maninita ba kayo na mga kumakain sakaling lumagpas sa 30% or whatever? Paano ba? Ang hirap na trabaho nyo. Diba?
Yes. Luchi, alam mo, tama yung mga observation yung ganyan. Minsan para bang imposible mapatupad yan. Madaling sabihin yung mga percentage, di ba? Pero alam nyo kasi ang DTI naman, being on top of it, naglalabas sila ng mga guidelines. And all these industries, particularly the specific establishments na part ng mga industries na yun, alam na lang po ng gagawin nila. Hindi mo pwedeng gawin po ng PNP yan. Kaya nga sinasabi ka natin, for our people to follow this protocol, make them conducive na sundin, di ba? Kaya nga po, andun yung effort nila. Sa amin, bandang huli na lang po kami. Minsan, paikot-ikot na lang, pagpapalit pupunta kami doon. Pero not because ang isang guideline ay mahirap sundin, hindi na natin ilalabas siya because based on the study of the expert in the ITF, yan ang dapat gawin. Whether mahirap sundin yan o hindi, mahirap patupad o hindi, pero naandyan po yan. And at the end of the day, dalangin nating mga law enforcers natin na talaga namang nagkakasakit na ng todo-todo is for the community to realize na kailangan nating sundin ito even without us implementing or enforcing these guidelines.
General, sa Holy Week pa rin, kasi talagang vacation time yan Pwede bang puntahan ng mga tao yung mga resorts? Kasi nandiyan sa Laguna maraming resort. Sa Cavite merong mga beach resort.
Okay, magandang katanungan yan. Yes, magandang katanungan yan kasi kung tutuusin natin, itong mga lugar ito is non-essential na, di ba? But still, kagaya sinabi nga natin at nireview ko doon sa mga guidelines na the essential and non-essential goods and services na allowed is permitted pa rin dito po sa ating bubble. So yun, within the bubble naman siya di ba? Halimbawa Tagaytay or Laguna. Pero yung pagpunta mo doon is subject doon sa mga strict measures na pinutupad natin. Ano ba yung mga yun? Wala dapat mass gathering. So meaning, hindi dapat kayo marami. And then kung dapat pamilya lang kayo. At isa pa, absolutely, and we want this to be emphasized, is that absolute na hindi pwede ang mas bata sa 18 years old o mas matanda sa 65 years old. Hindi po ito kagaya ng dati na staycation na member of the family na bata o matanda is pwedeng isama. on this particular 2-week period na ito, kung meron man siyang parang staycation ang labas while pumunta sa Tagaytay, may reservation doon, subject to the protocol there, nung LGU at nung mismong establishment, dapat po ay walang kasamang minor at saka yung more than 65 years old.
Sir, for the benefit of those who will have to cross the checkpoints, yung crossing in between Metro Manila Plus and the other provinces around, kasi I'd imagine, it's easier if you belong to the formal sector. For example, meron kang ID ng kumpanya, di ba? It's easy to prove it. O kaya meron kang certificate from your boss. Pero the bulk of workers today belong to the informal sector. Ito yung mga taong wala talagang ID, walang certificate, nagbebenta ng balot, nagbebenta ng taho, o kaya driver ng family driver and so on and so forth. Will they be allowed to cross intra-zone? And or what do they have to do to prove that they can
Essential ba yung balot?
Yes, essential po yun. O kasama yun, sa pagkain yun eh. Ed, kung di ako nagkakamali, tama ba yung intra-zone? Within ba? I mean,
crossing the zone, crossing the zones. For example, Bulacan going to Pampanga. Lalabas ka na ng Metro Manila Plus eh. Diba?
Bulacan, pupunta ng
Pampanga. Lalabas ka na bali ng Plus. Lalabas ka na ng Plus.
Interzone. Yes, yung pag magko-cross ka na doon, yun kailangang authorized ka na doon. So meaning, essential worker ka. Tama sinabi mo na, well, for the formal, dun sa mga personnel who are in the formal sector,
may ID kasi ngayon eh.
Pero alam mo, kagaya kanina sa inspection ko doon sa may Kalumpit at sa Apalit. Kalumpit is Bulacan, Apalit is Pampanga. Pagkita ko doon may dumadaan na wala naman silang mga ID, pero makita mo naman, dala nila yung mga lalagyan ng itlog, di ba? Na nilalako, binebenta nila. So, yung essential worker yun. Tapos may nakita ka doon, may kasamang bata, nilapitan namin. Yung pala may dalang reseta galing sa hospital. Medical and humanitarian consideration.
Okay. Sir, I mean,
yes. Okay.
I think yung permutations and the possibilities for that are endless, no? Kaya ang isa pong kaakibat na tanong ko doon is, what about the penalties? Malinaw po ba kung ano yung gagawin nyo? Let's say may mahuli kayo, whether legitimate or not. Ano po ba talaga ang pwedeng gawin ng mga pulis kung may makita silang nagpenalty? Because alam niyo naman po kung saan pinanggagalingan to. Marami ring nadidismayang mga kababayan na sinasabi, ano ba naman to? Nahuli pagkatapos kinulong ng ilang araw or nahuli, pinag-push up. Kita ko sa picture sa push up, hindi naman nakamask din yung mga tao or di nalagay sa siksikan ng mga ano. Para lang po malinaw, what is within your mandate to do pagka may nahuli? Kahit saan pa pong lugar sa Metro Manila or even outside the NCR Plus.
Yes. Okay, Robbie, dun muna tayo dun sa sinasabi natin na boundary. Kasi nga, ang gagawin kasi natin dyan, kung hindi sila authorized na mag-cross, we'll just deny them passage.
Okay.
So wala po yun. Hindi ka pwede pumasok, balik ka. Ngayon, kung talagang makulit, halimbawa, nagsiga-siga pa doon o pumalag pa doon, so yun, ibang usapan na yun. That is resistance, resisting
So
arrest.
hindi naman huhulihin.
Opo, pero
yung
hindi
mga
po,
nag-a-attempt.
pinababalik lang natin actually yun. Pero yung mga not wearing mask and face shield, wala rin po tayong hinuhuli doon eh. Pero yung makukulit talaga, well, depende kasi sa mga ordinansa. In Metro Manila, wala tayong problema, lalo na yung mga curfew. Kasi meron mga ordinansa doon eh. At napakaganda nun, ang first violation, fine. Titikitan ka agad, tubusin mo yan. Kikita pa yung LGU, di ba? Napakaganda, hindi mo pa kinulong. Wala tayong problema. Yung pangalawa, pwedeng community service at yung pangatlo na yung pagkakulong, pero hindi na dumarating yun dun eh. So, kalimitan actually, kung makikita natin dun sa ating statistics, yung mga nahuli natin, yan yung mga disobedience at saka resisting arrest na rin. Pero minsan kasi, sa tagal kasi, isang taon na tayo nag-warning sa kanila. So, yung iba talagang dinadala na rin sa mga station. In Manila, nakita natin na doon kasi sa ordinansa nila, talagang pinapile nila ng kaso pero hindi nakakulong. Dadalhin nila, booking, documenting, then pinauwi, pero file ng kaso. Intayin mo ngayon yung subpina mo para harapin mo. Pag hindi, magkakawarrant to arrest ka. So, depende. But all of this is based on ordinance. Ito, baka naman idugsong na rin natin kasi di ba nagkaroon nga tayo ng plus. So, the other 4 provinces, hindi kagaya ng Metro Manila, na nag-usap-usap yung Metro Manila Commission and the mayors na meron silang uniform ordinance for the curfew. Doon sa iba, the DLG is encouraging them para maglabas din sila o magsulong nito. Sa ngayon, kung walang ordinansa, pwedeng warning na lang. Pero kung kawala-walaan talaga, Andiyan kasi yung batas natin na RA 11332, which is specifically non-cooperation of person and entity affected by this health event of public concern, ang pwede nating apply sa kanya. Pero very generalized yun. Pero sa totoo lang, at the end of the day, ay talagang maximum tolerance din ang ating binibigay at puro paalala ang sinasabi natin sa ating mga kababayan.
Sir, tsaka yung RA 11332, binasura ng DOJ yung kaso laban kay Coco Pimentel kasi hindi naman daw siya, I mean, it's not applicable to ordinary people.
Well,
sabi ng DOJ.
Tama po, pero pwede pa natin i-file yung kaso, di ba? Kasi may base pa rin kasi. Kasi minsan, kailangan na may base kami para ma-take into custody sila, di ba? At yung batas naman yun, so eventually, depende na po yan sa ating sa fiscal office para i-assess, evaluate nila. Pero sa atin, kung walang-wala, yun talaga ipapile natin kaso. But we encourage also yung ordinance ng ating mga LGUs para may base naman tayo sa pagpatupad.
Okay, PNP OIC Lieutenant General Guillermo Eleazer, maraming salamat po.
Maraming
We
salamat,
need to take a break. Please stay with us. The Chiefs will be right back. Welcome back, the Chiefs, here on One News. We continue our conversation. Now joining us is Presidential Advisor for Entrepreneurship, Joey Concepcion. Good evening, Sir Concepcion.
Good evening.
Good evening, sir.
Yeah.
Good evening, Ami, Ed.
Sir, obviously tough times, and really we know a lot of people were looking forward to a reopening of the economy. They were looking forward to the Holy Week break. The context for everything has been upended over the past 2 weeks. As a captain of industry and also as somebody who mentors small businessmen, what do you tell each other? I mean, heading forward, looking forward, what's the frame of mind that industry as well as MSME should have right now?
Well, as you know, we have these programs with DTI and DA. We're mentoring thousands of MSMEs at this point. And in our conversation with our entrepreneurs, we are giving them hope. Now, I've been telling them that let's look at the fourth quarter this year. While we are at this modified, I call it a modified lockdown, and I would agree with the government. They've done it at the right time. Of course, the people in the tourism sector will be hit because many of them have bookings. But then again, the Holy Week, really, most of the entrepreneurs take a break as well, no? Because we have the Holy Week, so nobody does business during this period. So it's the right time. And with the rising infection, I think it's good to take a pause. No? Of course, we were optimistic that as the vaccines do come in, we're able to open the economy much more. No? But the problem is that we have to contain this infection, or else it will get out of hand. And I am still optimistic, no, that as the vaccines arrive towards the third quarter, we will be able to open up the economy towards the fourth quarter. No? So, but it all depends on how fast these vaccines will. I mean, they're scheduled to arrive, and especially in the third quarter. And we just pray that we are able to execute. So most of the private sector at this point in time are already planning the execution, which is basically choosing the right logistics provider. In our case, AstraZeneca, we've chosen Zwellig. No? So we're preparing for a rapid implementation of the vaccinating our employees. And that's going to be a challenge, but we have to do it.
Sorry, if you don't mind, I mean, just to catch a couple of things you said there. You said, as we expect them to arrive, and then you quickly said they're scheduled to arrive. How big is the gap? How real is the gap between the scheduled arrival and the best and the worst case scenarios for when they will actually be here?
Well, you see the COVAX of the government. Now that's about 44 million expected to arrive within the year. Maybe till next year, but 4.5 million of AstraZeneca is arriving out of COVAX, no? And that's for government use. Now, AstraZeneca for the private sector coming out from Thailand, that's still scheduled to arrive on May and June, no? And that is different from what is happening in Europe. So we're insulated from the supply issues in Europe, no? So I've been assured by the CEO that that is arriving, but it will be coming in tranches every week, no? And we have a portion that goes to the government there, no? And we've agreed on that. Now, the bulk of that's 2.6 arriving in May and June, but the 14.5 million, which is where the LGUs, 39 LGUs, and the rest of 300 companies are in, that is arriving in the third quarter. And you have also Novavax that is also arriving in the third quarter. Right now, the private sector has secured about 1 million doses only as of this point in time. Moderna is about 8 million. This is the group led by Ricky Razon, who has secured 8 million doses for the private sector. That is also arriving in the third quarter, although they're trying to see how they can accelerate it towards June. Then we have the new vaccine called Covaxin of India, called Bharat. That they have 1 million doses planned to arrive on the second quarter. But then that's dependent on the EUA that will be approved. And hopefully it's approved by the third week of April. So in a snapshot, that's on top of the other orders of Secretary Galvez, no, Gamalaya, and all the other vaccines. He has close to 160 million doses planned ordered, no? And his intention is to vaccinate 70 million people before the end of the year. And we are playing in that figure as well. Now, we are part of that, being the private sector. So that is the goal. There is a plan. People have been saying the government has no plan. The private sector is not being given access to these vaccines. And I think that's unfair. No, Secretary Galvez was very instrumental in working with us to put up that tripartite agreement, which was started with our group and AstraZeneca and has been mirrored by all the other vaccines that the private sector has now secured.
So is there even a chance that private sector can actually directly order or import vaccines, which is what the PCCI is urging the government to do? And a couple of doctors, including Dr. Cabral, who was former health secretary, is there a chance that this is possible?
First of all, I don't think the pharmaceutical companies will do it. No? In the earlier discussions with AstraZeneca, when we signed with them, it was mandatory that the tripartite be formed. One, because of the indemnification that protects both pharmaceutical company and the private sector. Number two, under EUA, the government should be the one owning the doses. So if you look all over the world, the countries, the governments are the one importing the vaccines. It is only in the Philippines that the government has allowed us to partner with them and for us to buy our own vaccines. So that's unique. That's never done in the world. The question is, why is the private sector doing it? Yes. Why don't we let the national government just do it? Well, I'd rather already secure my vaccines, earmark that quantity so that I'm sure that our employees will be having those vaccines. And it just gives us that comfort level that we already have the vaccines of our choice. No? So we were able to choose AstraZeneca and all that vaccines.
Right, but I guess the question is arising from the fact that they find the supply too slow, that they can't wait, that they feel at least that they can facilitate the process and get the vaccines earlier than scheduled by the government. Is that validated by your negotiations or by what you know so far?
You can see very well, no? In the case of AstraZeneca, we were very fortunate to acquire vaccines and be the first, no? Last year, no? In November 27. documented, paid for. But the risk of us doing that, the first group, we purchased 2.6 million. We had to fork in a couple of 100 million. We had to sign a document that says that if, for whatever reason, AstraZeneca will not get their FDA approval, which they call MHRA, that our deposit will be compromised. Now, these are major conglomerates. And so we all agreed that let's take the risk. And we did, and it paid off. But I don't think the country or the government can do that. We have laws that prevent them from doing that. Other countries, wealthier nations, what they do is they donate or advance purchase and all of this stuff. And America controls three or four vaccine producers. No, so the Philippines is not as rich as these countries. But in fairness, if you look at it, even in Moderna, where Ricky Razon together with the government secured 20 million doses, the 8 million went to the private sector also. So yes, we are able to get the vaccines for the private sector, and we buy that security that we already have an allotment. No? And so with Novavax and the rest. No? So what I'm trying to say is that the supply is very tight all over the world. Now, private sector can move faster because it's our money, but the government has to go through a whole process and respect the laws of the country, and that's what ties Secretary Galvez. But despite that, he's able to do it. No, of course, with certain challenges. But there's a big difference with owning your own company and throwing your money and buying these things. No?
Well, sir, Ambassador Yuiko was telling us last week about, of the PCCI, was telling us last week about missed opportunities, using his words, from 2 months ago when we could have gotten a lot of doses from Bharat in India at a cost of around 150 pesos per dose. And sabi niya, it was almost good to go. They were just hoping to get approval from the government. It never came.
That's not correct, because we're talking to Bharat, and that's the distributors of that is Ambika and Biotech of Enrique Gonzalez, and they're barely into their phase 3 trials at this point in time. So way back then, they were not in the picture yet. No, I mean, but yes, it is a good vaccine, and we are supporting the entry of Bharat here. And even that, the EUA is under process at this point in time. Mm-hmm. So yeah, I don't know if they were in touch with the right people. No, but these things take time, and the third phase trials are very important for what they call this FDA here to give the go signal. No, and now that they've completed the phase 3 trials only in this period, they are now, in fact, they've allocated 8 million for the private sector. No, so I mean, and the phase 3 trials are just completed. So now I think the EUA will come out maybe after Holy Week, no, or before the end of before May. No.
But they seem to be having trouble with tripartite agreements, and they are saying it's easier. Well, we talked to Mr. Yuiko. He said he got help from the Indian ambassador, and they're getting help directly, I think, from the company. And they seem to be having problems with this tripartite agreement. Can there be a compromise? No. Are you talking to PCCI?
No, I am not working. I'm working with George Barcelon and the rest. No, I'm more familiar with the intricacies because we structured the tripartite agreement with AstraZeneca and Secretary Galvez. No, and it is a landmark. If you look at Mr. Razon, no? He's used the tripartite, and the group of Kishore Imlani of Novavax and Clint and the Unilab people are also using the tripartite. And even Bharat, I've guided them that they have to use the tripartite. In fact, they asked our lawyer to help them go through the tripartite. And you cannot do it without the tripartite, I'm telling you that, because the government is the only one allowed to bring these vaccines in. And that's the way it is.
Mr. Concepcion, I'm sorry to interrupt, but at this point, we'll have to switch to Malacanang, where the president is delivering a live address.
Thank you. Good night.
Economy, and that's a problem. It will be disaster for our country. Kung sarahan mo talaga lahat, it would be disaster for the country. So, balance na lang tayo. Total maliit pa naman ito, small, not really small, but in not so many are being affected. Hindi afflicted in the sense that your movement are being curtailed. And the curtailment of your free to travel is always subject to the power of the state to control the movement of its citizens, especially if there is a pandemic. The state has that kind of power. Although hindi yan sa martial law, it's just putting you in the right places at the right time, at this time. So, may listahan lang kasi ako dito na I have promised you that I will be reading the persons who have been dismissed, na paalis sa gobyerno. Ano, Chaser, Dennis Lumboy, Attorney 5, National Police Commission sa Napolcom. Grave misconduct for demanding bribe from a claimant to facilitate the processing of an application for death benefits claim pending in his office. Marami to. Hindi lang ito. Si mga sundalo, pahirapan. I don't know of some place, but dito sa amin noon, matagal na. Ang practice kasi, ang mga byuda, pupunta pa dito sa krami. I won't go if it's still being the practice now. But if it is still the practice, I'm ordering you to cut it now. Sabi ko, yung mga byuda ng pulis, pupunta pa dito, they go to Manila, spend money, stay here, not knowing where to stay, and not they go to the traffic bedlam just to reach Krami and to follow up this. Alam mo, kayo na yan. There should be an office that should take care of this. Preparado na yan. Pag sinong may notification na namatay, sa trabaho yan ng station commander to inform dito. Marami pang police to kasi Polcom cut the crap. Sa regional na lang nila i-follow up. Kayo ang magpadala. The PNP has the resources. There are almost a lot of people there walking around. I don't know if they have work to do. But hindi ko na gusto I don't like the idea because it is susceptible to so many things. Kung maganda ang sa Davao noon, ganito yan. Yung biyuda ng pulis na namatay, follow up dito. Eventually, pag uwi niya, buntis siya, kukunti na lang yung dala niya sa This is a disgrace to government, pati sa atin, pati sa ako. Nakakahiya kasi yung ganun. Gawin ninyo, doon na sa region ang magtatrabaho. Marami kayong trabahante. Bakit hindi nyo karaming babae na hindi mo naman pwede padala ng gera sa gera yung mga nurses na nagpulis? Pwede pa trabahuin mo yan. One division. At yun ang nabi. At a moment's notice na mayroon namatay, then they begin to process. And eventually, sila na.
All right, we're back here on the Chiefs, and for those of you who want to follow the president's speech, you may go online to One News. All right, and we're back, and we would like to welcome our next guest, Robbie.
We're in the final stage of our conversation, and we're with Dr. Iggy Agbayani of the Concerned Doctors and Citizens of the Philippines. Good evening, Doc.
Good evening, Doc.
Naka-mute po yata kayo, Doc. Naka-mute yata kayo, Doc.
Hi, good evening, Robbie. Good to see you again. Ed, Ami, and Luchi.
Yeah.
Good evening po.
Hi, Doc.
Doc, let's get right into it. Ilan ba ngayon? 8,000 plus cases. I think everybody now is really primed not just to take the bad news, but to really respond to some kind of call to action, even drastic calls to action. How is the medical community bracing itself right now? I mean, bracing might not be a good term because we're already in the middle of it. But what is the mindset now sa medical community when every day we hear na puno na ang ICU, puno na ang beds, and how are things on the ground?
Well, I'm not exactly a frontliner. No, I'm an orthopedic surgeon. But yes, I could feel my patients having some fears about going to the hospital, for example. And I see the numbers in PGH and in my hospitals. The cases are really going up. And some of them are severe. So meron talagang takot. And of course, it's only natural.
Okay.
Okay, the thing I really want to bring up with Dr. Iggy is this controversy over ivermectin. No? I know personally that the use of ivermectin among so many Filipinos in recent months has been rising. And as a matter of fact, I have in my possession a few capsules of those. No? I have heard anecdotes about how effective it is. I'd like you, but we know also for a fact that I think over the weekend, the doctor who has been compounding ivermectin for use here has been warned to desist from doing so. I'd like to ask you about that. Just who do we believe when it comes to the matter of the use of ivermectin for COVID?
Yeah, I agree. It's difficult because we hear so many things about is it effective, is it safe? And you will hear one doctor saying, no, it's not recommended. And then our group is saying it works. So I understand the difficulty, but for what I can say is that we're an independent group of doctors. We're not related to any private group, and we are doing this mainly to help our Filipino countrymen. So we have reviewed the data, and we are questioning our colleagues who are saying it's not enough. And just to date, I can tell you that there are 60 scientific studies that show that ivermectin works. 24 of them are randomized controlled trials. So I cannot understand why they say that kulang pa, na dapat gumawa pa tayo ng trials. So it's already 24 randomized controlled trials, and this is worldwide. In fact, 31% of the world is already using ivermectin. So how come they're still saying that this is for animals?
Yeah, for animals now.
Right.
That's the warning
Yes.
of the FDA today.
We do not understand. Yeah, we
But-
do not
but
understand that.
But
We
it's
do
the
not
warning. It's the warning of the FDA, and for that matter, it's the warning of the U.S. FDA. I mean, when
Yes.
we trust the FDA and the countries with stringent mechanisms for us to choose which vaccines do we trust, it makes sense to say that we will trust them as well for on other things that they do not want to endorse.
No, as scientists, we actually trust the studies. FDA is fine, but they're not always right. We follow them, but you cannot always say that they're the gold standard. So, like I said, there are over 60 studies, and these are very scientific studies. And we have meta-analysis. There are, in fact, 4 meta-analysis of ivermectin, which also positive effects of lowering the mortality to COVID. So I think we should listen to those.
Yeah. Doctor, if you don't mind, I'd like to backtrack a bit. Ivermectin, in your view, is a treatment or a therapeutic treatment against SARS-CoV-2, or is it a protection against SARS-CoV-2.
It is actually both. It is both.
It's both. Kasi I saw
prophylaxis.
some literature saying that there were encouraging signs that it is an inhibitor of SARS-CoV-2. So that much I have seen going around, at least in some scientific circles. But my question is this: kasi you have the Philippine FDA and the US FDA saying that it is not yet approved. They're not naman saying, from what I can tell, they're not saying that it is bad per se, kasi it's also used for humans as a treatment of parasitic forms. There's a form used for humans, there's a form used for animals or for horses. So those are two different things. Pero nga, it does go back to that. You're talking about two FDAs, both the US and the Philippine FDA, saying that there is not yet enough evidence to show that it can be used to treat SARS-CoV-2. So saan po nagkakaproblema? I mean, you're saying hindi naman kulang literature. So paano po?
Bok, pasensya na, let me add also. I mean, the FDA does, the US FDA does also say not just that there is not enough evidence of its harm. It is saying that it can be harmful in certain cases. The US FDA says it can interact with other medications like blood thinners. You can overdose on it, especially if it's not for that purpose. It can cause nausea, vomiting, diarrhea, hypotension, allergic reactions, dizziness, ataxia. So I mean, correct me if I'm wrong, sir, but the US FDA is also standing on research as well.
Robbie, may we introduce the other guest also at this point, no? Because he's been here online. I see him in the Zoom, no? Dr. Homer, we'd like to introduce.
Good evening, Doctor.
Good evening. Good evening.
Doc. Yeah, please jump into the discussion.
Can I answer the question about the safety issue? Well, Ivermectin has been around for 40 years. And it's been tracked for side effects for 25 years by the WHO itself. Of those 25 years, there have been 3.5 billion doses that's been given. And for 3.5 billion doses given, you only have 16,000 reported side effects. If you can show me a drug that's safer than that, that's a very, very safe drug, as I can see. Now, I agree with the FDA.
Doctor, 3.5 billion doses for what? Treatment for what?
For different diseases, not necessarily COVID, but it has a history of safety. So,
human yun, human? What diseases?
Yes, human doses.
What illnesses are those?
For parasitic infection, for infants, even for infants, they're giving ivermectin for infants and babies who develop head lice and scabies. So these drugs are, in fact, the Philippine Drug National Formulary, which is published and made by the Department of Health, one of the drugs as an essential drug is ivermectin in 3 and 6 milligram tablets. So to say that ivermectin is only for veterinary use is very, very misleading, because even Department of Health says so, that ivermectin is as an essential drug for Filipinos.
Yes.
So I think that is what we have to make clear. It is not true that it's only for veterinary use.
Yes, but I think, Dr. Lim, you'll also have to say, Dr. Lim, that yes, it may be an essential drug, but that also has to be qualified. It's an essential drug for very specific cases. And the point is, it has not been cleared by the FDA, in particular for COVID. You cited the case of particular diseases, and yes, it's not, ivermectin for humans is different from ivermectin for people. But if you can make that distinction, why not make the distinction also that all the cases that you've cited are people who have been prescribed for specific cases, not for COVID? But that's the only thing that FDA is saying, you will agree. Right now, that's the only thing that the FDA is saying. We don't have the body of data right now that will also prove it on the other side, that this is safe for...
That is what they claim, but studies, worldwide studies have shown that ivermectin really works from meta-analysis. Now, it's a matter of who is talking and who is the real authority. I think that's the main question.
Well,
honestly,
yes, but right now the authority in the Philippines is the FDA. Hindi po ba? And they are backed up
Exactly.
by their own technical advisors who also happen to be researchers and scientists.
So I would like to ask the question for those who have the technical advisory team. Why don't they disclose all their financial interest? I have no financial interest. I don't make drugs. I don't receive any financial interest from all these drug companies. How about those who in the technical advisory committee? Would they like to disclose all their
Well,
financial interest for the last year?
Okay. Let's be fair to everybody who's not here. They are not here as well. But I do remember a conversation here. I think it was Dr. Dance's, Dr. Dance and Dr. Dance, who addressed precisely your question, sir. They looked at the NITAG and they said, we looked at the NITAG, we can tell you the people in NITAG are unassailable when it comes to whether or not they have conflicts of interest. Now, if you're saying that the people of NITAG have conflicts of interest, then you produce that evidence. But an independent group of doctors have said, we have looked at, and they said it here on the show, that we looked at the people comprising NITAG who gives advice to the FDA, and we have seen nothing to assail them on their integrity in that regard.
What I want to know is this. Has the FDA even looked at your data? Have they?
Yeah. Well, first of all, it's not my data. This
Well,
data
yeah, whatever
is
the data.
available.
Kasi
Yeah,
ako
it is
naman,
available.
parang feeling ko, because it's very cheap, it's, I mean, compared to the fact that there are no cures right now, you have to be hospitalized to get remdesivir, if that's even acceptable to them. But as far as I'm concerned, what I want to know is if it's in their formulary, and there are studies all over the world showing that it is safe, that at its worst, it's not going to cause any death. You know, at its worst, it will just not cure COVID at its worst. No,
Yes.
have they at least given it a try? You know, pinag-aralan man lang ba nila? Have they attempted to do that, as far as you know? Because we're at this point, you know, with the rising number of COVID cases, the only option available to us right now, aside from lockdowns, is the vaccines. So that's the reason why this ivermectin is promising something to people who are desperate, you know. So I'm just wondering if the FDA is even addressing it.
Yeah, that's an excellent point, Luci, because we are not in normal times. We have an emergency. We have a vaccine that's being allowed only as an emergency use authorization. Otherwise, we won't have it this fast. Now, we are asking, there's a gap actually in the treatment. We don't have early treatment for COVID. When you get sick, you just wait. Sometimes you're given a steroid, something to calm your fever, but there's no real treatment available out there.
Right.
We've asked the DOH during one of the Senate hearings it was mentioned by Senator Tito Soto. And that's their answer. They have remdesivir, but that's used in hospitals. So right now, people are dying. Let's admit it, people are dying. Am I going to wait for 500 randomized control trials? We already have 24 randomized control trials. And as to their point that they're saying that there's not enough studies, they only cited 6. So if they look at the latest numbers of randomized controls, they're 24, and there are 40 others, and all of them, if you count them, 60 studies, all showing positive results. Now, if you can tell me a drug that just has 5% improvement of avoiding death and is very safe, wouldn't you take it? You would.
Doctor,
Because it's 5%.
Let me try to
But if you have a drug that's
reframe
60%,
that question
yeah.
po. Doc, ganito po. Kasi for one whole year, everybody has been looking for a solution to COVID-19. My question is quite basic. Why is this drug not being considered at all for application or regulation by any of the FDAs? Is it a question lang ba of somebody having to apply for it to be used by the FDA? For example, Gamaleya applied for the use of Sputnik and so on down the line. Yun lang ba ang kulang dito for it to be considered under clinical trials?
We could have actually had our clinical trials as early as July. There were already some studies, basic studies. There were in vitro studies, yung bang nasa laboratory, if you can see that ivermectin can kill a virus, it does. So even at that point, we could have started a trial or what you call a pilot study. But again, there's so many countries doing it. Like I said, 31% of the world is already using it. Slovakia, Czech Republic,
Pero dito ba may application na? Dito ba may application na? Meaning, have you applied? Has Dr. Landrito, who's the one who compounds it,
kasi po in the end, it's a process po eh.
applied,
It has to
yes,
be a process.
for FDA certification. Has he?
Well, yes, he actually has, and it's pending. It's for certification for. It's just a license actually to sell because you can actually prescribe. As a doctor, I can prescribe ivermectin. It's not illegal. There's such thing as a repurposed drug, and there's an agreement between the doctor and his patient, and he can repurpose a drug, and it's used often, like glutathione, for example. This is some of the things that can be used for another purpose, and it's not illegal. Now, the FDA is saying it's not recommended, but they're not saying it's illegal. You will be sanctioned if you use it.
Doctor, I was going to ask about that. Kapag sinabi ng FDA that it's only for animals, tapos it's not a treatment for COVID, can doctors prescribe it?
Yeah, when they say only for animals, just they refer to the animal grade. Just to be fair to the FDA, di naman nila sinabing only for animals. The animal grade ivermectin is for animals.
Okay. So, can doctors prescribe it for COVID kapag sinabi ng FDA na hindi pa siya?
Well, as early as March of 2020, DOH already came out with a memo saying doctors can prescribe off-label antiviral medication for COVID-19. So, yes, doctors can prescribe off-label.
So why are they suspending Dr. Landrito?
It's a good question.
No, there's no suspension. I don't think there are no suspension with regards to Dr. Landrito. I think it's Dr. Landrito who said that he will stop compounding or making ivermectin.
Doctors, I think it's fair to say we're all laymen here. Diba? We're all trying to read up the pros and cons and so on. And so that's why we always get back to the question of, well, who's the authority? And whether or not the authority and the regulators here are credible. We seem to ascribe credibility to the FDA, to the NITAG. I mean, people run to the FDA and to the NITAG to back them up when government seems to be saying idiotic things and seem to be irresponsible, and we trust them there. Why don't we trust the FDA when it comes to this? When all they're saying is, as with the vaccines, we have a process to follow. In the meantime, the FDA in the U.S. and the NIH in the U.S. are saying, then this much we can say for both sides, NIH in the U.S. is saying there is not enough data to either recommend or to outright say it is harmful. But in the meantime, therefore, we follow the process. What's wrong with that?
Because people are dying. So
Exactly.
there's such thing as a relationship between you and my patient. I mean, my patient is dying. I still follow the recommendation. I have a drug that I already know has 60 studies that helps prevent mortality. Do you want me not to give that? That's immoral on my part.
Right.
I mean, as doctors, we have a moral obligation. That is, sadly, that is saving lives. And right now, we're really trying hard to make this affordable and available for everyone. Because if you don't have money, how can you afford going to the hospital? Or even if you go to the hospital, how many of them are being turned away because there's no space? Why don't we give everyone a fighting chance? That's the only thing we really ask of the government.
Okay. All right.
Okay. Thank you, Drs. Agbayani and Lim. In the meantime, unfortunately, that's all we have for this special edition of the Chiefs. We hope what was discussed here will keep the conversation going. Before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines. I'm Robbie Alampay.
I'm Ami Pamintuan of the Philippine Star.
I'm Luchi Cruz Valdez of News 5.
And I'm Ed Lingao. We are One News.